Did you know that something as small as the fruit on your plate could be quietly damaging your kidneys? Or even worse, making your creatinine levels rise without you noticing? For seniors, this is more than just a health tip. It's a serious warning. Because as we age, our kidneys naturally slow down, and what we eat can either protect them or push them toward failure. But here's the good news. With just a few simple changes to your fruit choices, you can help your kidneys function better and say goodbye high creatinine once and for all. Today, I'll share 5 fruits every senior must have and 7 dangerous ones you should never touch if you want to keep your kidneys healthy and your body strong. Let's get started. Your kidneys will thank you. High creatinine is a serious health concern, especially for seniors, as it often signals that the kidneys are not working as they should. Creatinine is a natural waste product that comes from the normal wear and tear on muscles. Every time our muscles are used, they produce a small amount of creatinine. This waste is filtered out of the blood by the kidneys and passed out of the body in urine. When creatinine levels in the blood are higher than normal, it may indicate that the kidneys are no longer filtering waste effectively. For younger people, this may be caused by intense exercise, dehydration, or certain medications. But for seniors, high creatinine levels usually point to more serious chronic problems. As we age, our kidneys naturally go through a process of slow decline. Just like our joints and muscles, the kidneys too start to show signs of wear. This is why high creatinine is more common in older adults, even in those who are not showing other symptoms. Seniors are more likely to suffer from conditions that damage the kidneys over time, such as high blood pressure, diabetes, or heart disease. These conditions reduce blood flow to the kidneys, causing the kidneys to lose their filtering ability. Additionally, medications that are often prescribed to the elderly, like certain painkillers, antibiotics, and blood pressure drugs, can also increase creatinine levels if not carefully managed. It's important to understand that high creatinine isn't a disease by itself, but rather a warning signal. It tells us something is wrong with the kidneys, and if we don't act, the condition may progress to chronic kidney disease or even kidney failure. This makes early detection and lifestyle changes critical, especially for seniors. Since they may not experience any symptoms until the problem becomes serious, regular blood and urine tests are essential for early diagnosis and treatment. If caught in time, high creatinine levels can often be managed or even lowered through diet, hydration, exercise, and medication adjustments. Another factor to consider is that older people naturally have less muscle mass, which usually means they should have slightly lower creatinine levels than younger adults. So, when a senior shows high levels, it may be more significant than it first appears. Even a small increase in creatinine can suggest major stress on aging kidneys. That's why doctors pay close attention to creatinine in elderly patients. It helps them assess how well the kidneys are working and how aggressively they need to treat the issue. Stress, infections, and dehydration can also spike creatinine levels, especially in older individuals. Seniors may forget to drink enough water or lose fluids quickly due to medications or illness. When the body becomes dehydrated, the kidneys can't filter properly, causing creatinine to rise. Something as simple as not drinking enough water can become dangerous if ignored. Seniors also have a harder time bouncing back from such problems because their kidneys are already under stress. Therefore, hydration plays a key role in maintaining healthy creatinine levels. Encouraging seniors to sip water throughout the day and avoid drinks that dehydrate the body, like coffee and alcohol, is an easy yet effective way to support kidney function. Another challenge is that symptoms of high creatinine are often silent or mistaken for general aging. Seniors might feel tired, weak, or confused, and these signs are often ignored or blamed on old age, but these are also warning signs of kidney issues. Swelling in the legs or around the eyes, changes in urination, or shortness of breath can all be related to kidney strain. That's why caregivers and family members should watch for any changes and ensure seniors get regular checkups. Ultimately, knowledge is the key. Educating seniors and their families about the importance of monitoring creatinine can prevent a serious health decline. A healthy lifestyle, regular lab tests, kidney-friendly diets, and awareness of medications are all essential tools in the fight against rising creatinine levels. When understood and managed early, seniors can enjoy a better quality of life, keep their kidneys functioning well, and avoid dangerous complications. Fruits play a powerful role in maintaining kidney health, especially for seniors dealing with high creatinine levels. These natural foods are not just a source of vitamins and fiber. They also contain antioxidants, anti-inflammatory compounds, and hydration benefits that can support kidney function and overall well-being. For older adults whose kidneys may already be under stress due to age decline or chronic diseases like hypertension and diabetes, choosing the right fruits can make a meaningful difference in managing creatinine levels. The kidneys are vital organs responsible for filtering out waste products like creatinine from the blood. When they are not functioning efficiently, waste builds up in the body and can cause fatigue, confusion, swelling, and other health issues. Seniors are especially vulnerable because the efficiency of the kidneys tends to decrease naturally with age. This process can be accelerated by conditions such as high blood pressure, poorly controlled blood sugar, or even long-term use of certain medications. Since there is no immediate cure for kidney failure except dialysis or transplant, in severe cases, prevention and maintenance become crucial, and that's where diet plays a huge role. Fruits, when chosen wisely, offer kidney-friendly benefits that are often overlooked. They are rich in water content, which helps the kidneys flush out toxins more effectively. Many fruits also have anti-inflammatory effects that can reduce the stress and inflammation around the nephrons, the tiny filtering units inside the kidneys. Moreover, some fruits contain natural compounds that help lower blood pressure and blood sugar, both of which contribute to improved kidney function. This becomes even more important for seniors who often take multiple medications and need to balance their nutritional intake carefully to avoid stressing their kidneys further. For seniors with high creatinine levels, not all fruits are equal. The key is to choose fruits that are low in potassium, phosphorus, and oxalates, minerals that when accumulated in the body can worsen kidney function. For example, high potassium fruits like bananas, avocados, and oranges may be healthy for younger individuals, but for seniors with compromised kidney function, these can become harmful. Instead, fruits like apples, berries, grapes, and cranberries are preferred because they have lower potassium levels and provide other benefits like antioxidants and hydration. These fruits not only help reduce the workload on the kidneys, but also support other aspects of senior health, such as heart health and immune function. Another important aspect is fiber. Fruits high in fiber help with digestion and reduce the buildup of waste products in the blood. They can also help regulate blood sugar and cholesterol levels, both of which are crucial factors in protecting the kidneys. Seniors who eat more fiber-rich fruits often experience better bowel movements, which indirectly supports kidney function by reducing the amount of waste the kidneys have to process. Moreover, fruits help in weight management, and a healthy weight is another important factor in keeping creatinine levels under control. It's also important to remember that fruits can be an enjoyable part of a senior's diet. Often, older adults lose their appetite or face challenges like poor digestion or difficulty chewing. Fruits are soft, flavorful, and easy to digest, making them an ideal food choice. Including the right fruits in the daily diet can encourage seniors to eat more regularly, stay hydrated, and feel more energetic, all of which contribute to better health outcomes. The goal is not just to reduce creatinine levels, but to support the kidneys in every way possible. A fruit-rich, kidney-friendly diet provides nutrients without putting unnecessary pressure on aging kidneys. Combined with proper hydration, light exercise, and routine checkups, the right fruit choices can be a simple but powerful part of a senior's health strategy. In many cases, this dietary adjustment can delay or even prevent the progression of kidney issues, allowing seniors to enjoy more independence and a better quality of life. When it comes to managing high creatinine levels in seniors, the right choice of fruits can play a powerful and healing role. There are 5 fruits that stand out as particularly beneficial for older adults who are working to improve their kidney function or prevent further decline. These fruits are not only safe for the kidneys, but also actively support the body's natural cleansing processes, reduce inflammation, and provide essential nutrients without overloading the body with harmful minerals like potassium or phosphorus. Incorporating these fruits into a senior's daily diet can be one of the simplest yet most effective lifestyle changes for managing creatinine and promoting overall well-being. The first and perhaps most recommended fruit for seniors with high creatinine is the humble apple. Apples are rich in fiber, especially pectin, which helps lower cholesterol, regulate blood sugar, and reduce the load on the kidneys. What makes apples particularly helpful is that they are low in potassium and phosphorus, making them safe for those with compromised kidney function. Apples also have anti-inflammatory properties and contain antioxidants like quercetin, which helps protect the kidneys from further damage. Seniors can enjoy apples raw, baked, or even stewed without compromising their health. Next are blueberries, often referred to as one of the healthiest fruits on the planet. These small berries are packed with antioxidants, especially anthocyanins, which give them their deep blue color. These antioxidants help fight oxidative stress and inflammation, both of which can harm the kidneys over time. Blueberries are also low in potassium and are considered a kidney superfood by many health professionals. Regular consumption of blueberries has been linked with lower blood pressure, improved heart health, and better cognitive function, all of which are essential for aging adults. For seniors, they are easy to chew, tasty, and can be added to smoothies, cereal, or eaten as a snack. Cranberries are another excellent fruit choice, particularly for their role in supporting urinary tract health. Seniors often face urinary tract infections, UTIs, which can further strain the kidneys if not treated promptly. Cranberries contain compounds that prevent bacteria from sticking to the walls of the urinary tract, thereby reducing the risk of infection. They are also helpful in reducing inflammation in the kidneys. It's important to note, however, that cranberry juice should be consumed in moderation and without added sugar. Whole cranberries or unsweetened cranberry products are better options for regular consumption. Red grapes are another powerful fruit for those managing high creatinine. They are rich in resveratrol, a natural compound that has been shown to reduce inflammation and protect the kidneys from damage. Red grapes also support heart health, which is closely connected to kidney health, especially in seniors. They are hydrating, low in potassium, and have a mild diuretic effect, helping the body get rid of excess fluid and waste. Seniors can enjoy them as a fresh snack or add them to salads and yogurt. Strawberries complete the list of top 5 fruits that seniors with high creatinine should consider including in their diet. Strawberries are high in vitamin C and antioxidants, which help boost the immune system and fight off infections. They also have anti-inflammatory properties and support heart and digestive health. Like the other fruits mentioned, strawberries are low in potassium and safe for most people with kidney issues. Their sweet taste makes them especially appealing to seniors who may have reduced appetite or difficulty enjoying other foods. Together, these 5 fruits provide a combination of fiber, antioxidants, hydration, and anti-inflammatory effects that can significantly help seniors manage high creatinine levels. They offer a natural way to support kidney function without putting extra stress on the organs. These fruits are widely available, easy to prepare, and can be included in meals or snacks throughout the day. For seniors who want to protect their kidney health and improve their overall diet, these 5 fruits are a great place to start. While certain fruits can be incredibly beneficial for seniors with high creatinine levels, others can actually do more harm than good. The kidneys, when under stress or already impaired, cannot effectively filter out excess minerals such as potassium, phosphorus, and oxalates. As a result, these substances can build up in the blood and cause additional complications. Seniors, due to age decline in kidney function, must be particularly careful about the types and quantities of fruits they consume. Understanding which fruits to avoid can play a vital role in maintaining kidney health and preventing further rise in creatinine levels. One of the most common fruits that seniors should limit or avoid is the banana. While bananas are rich in energy and contain beneficial nutrients, they are also extremely high in potassium. For healthy kidneys, potassium is important for muscle and nerve function. But in individuals with high creatinine or declining kidney function, excess potassium becomes dangerous. It can lead to irregular heartbeats, muscle weakness, or even heart failure in severe cases. Since seniors already have a higher risk of cardiovascular issues, adding too much potassium to their diet can be especially risky. This makes bananas an unsuitable choice for elderly individuals with kidney issues. Oranges are another fruit that may seem harmless but can be problematic. Like bananas, oranges are high in potassium and should be consumed with caution. Even a single glass of orange juice can contain more potassium than a person with kidney problems should consume in one sitting. Moreover, many seniors with kidney disease are advised to limit their intake of citrus fruits because they can also interfere with certain medications or increase the acidity of the blood. While oranges provide vitamin C, which is beneficial, the high potassium content outweighs the benefits when kidney function is impaired. Avocados are widely considered a superfood due to their healthy fats and nutrient content, but they are extremely high in potassium as well. A single avocado can contain nearly double the amount of potassium recommended for someone with kidney issues. While avocados may be good for heart health in the general population, for seniors with elevated creatinine, the potassium overload can be damaging. It's best for such individuals to seek other sources of healthy fats, like olive oil or small servings of nuts, rather than risk further harm to their kidneys by consuming avocados. Kiwi, though refreshing and rich in vitamin C and fiber, contains high amounts of oxalates. Oxalates are naturally occurring compounds that, in high concentrations, can contribute to the formation of kidney stones. Seniors who already have reduced kidney function are at greater risk of accumulating oxalates in the body. These compounds not only worsen kidney function, but also increase the likelihood of infections or blockages. Therefore, even though kiwi has some health benefits, it is best avoided by those who are trying to reduce creatinine or protect their kidneys. Dried fruits like raisins, apricots, and prunes might seem like convenient snacks, but they are highly concentrated sources of sugar, potassium, and sometimes phosphorus. Because the drying process removes water, but not nutrients, the levels of these minerals become highly concentrated in small servings. A small handful of dried fruit can exceed the daily recommended intake of potassium for someone with compromised kidney function. Piscinification. In addition, dried fruits often contain added sugars and preservatives, which can further burden the kidneys and negatively affect blood sugar control in seniors. Another fruit that deserves caution is star fruit. While not as commonly consumed, it is known to be toxic to people with kidney disease. Star fruit contains a neurotoxin that healthy kidneys can filter out, but when kidney function is impaired, the toxin can accumulate and affect the brain, causing confusion, seizures, or even death in extreme cases. Seniors should be made aware of this risk, even if star fruit is not part of their regular diet, to avoid accidental harm. Lastly, pomegranates, though often praised for their antioxidants and heart benefits, contain moderate to high amounts of potassium. While small amounts may be tolerated in some individuals, overconsumption can quickly lead to potassium overload. Seniors with high creatinine levels should consume pomegranate only if approved by their doctor, and always in moderation. Being aware of which fruits to avoid is just as important as knowing which ones to eat. With proper knowledge and a little care, seniors can make safe, kidney-friendly choices that help protect their health rather than unintentionally causing harm. In conclusion, managing high creatinine levels in seniors doesn't have to be complicated. By understanding what creatinine is and how it affects aging kidneys, we can make better choices that support long-term health. Fruits can be powerful allies, but only when chosen wisely. The right fruits, like apples, blueberries, cranberries, red grapes, and strawberries, can nourish the body, reduce inflammation, and support kidney function. At the same time, avoiding harmful fruits like bananas, oranges, avocados, kiwi, dried fruits, star fruit, and excess pomegranate is just as important. With simple dietary changes, regular checkups, and informed decisions, seniors can take control of their kidney health and say goodbye to high creatinine. It's not about strict dieting. It's about smart, sustainable choices that protect the body and promote a healthier, more active life in the golden years.